of us, when we look at a bus, we think about traveling. When we think about a hospital, we think about a building. But in this episode of Body Garage, we tell you about the story of the hospital in a wheel, where the hospital is put in the bus. Join us as we explore on what happens inside this hospital on a wheel. I'm your host, Dr. Chepsi. Welcome now to the inside of the mobile clinic, what we say it's a hospital inside a bus. And my guest today is Peter, who is the general manager of Checkups Medical, right? Yes, karibu sana Peter.
Thank you very much. Yeah, my name is Peter Makali Mnyasi. As you said, I'm the general manager of Checkups. And basically, Checkups is a technology-enabled healthcare provider. We actually help the ordinary Kenyan, mwananchi, mama mboga, to optimize health, to plan well such that whenever they fall sick, they're able to get quality, affordable, and accessible health.
Yeah. And how do you achieve that? By the three things that you've mentioned: quality, affordable, and accessible.
Yeah, well, Checkups, we have extremely high standards when it comes to offering healthcare to the public. So we make sure that all the processes involved in provision of healthcare, from the doctors who do it, the nurses, the laboratory technicians, the pharmacy, and also the supplies, are of very high quality. So that is how we assure or deliver on quality. About accessibility, we try to address the issue of cost. Our services are very affordable, and then we also try to understand how can we work with the ordinary Kenyan such that they're able to afford health. One of the barriers that the ordinary Kenyans face, mama mboga, is that they cannot afford, let me say, insurance. The premiums are high. And then we have those who can afford NHIF, but sometimes you have some limitations. So what we do right now, we're offering healthcare plans to these traders, people who are the ordinary people. With the system that we've put in place, an ordinary Kenyan can pay 276 shillings per day for 100 days, and they're able to access services in terms of outpatient services from our facility for 1 full year, for him, the wife, or the husband, and 2 children.
So it's kind of like a scheme.
Well, I would say it's a more of planning. What happens with the majority Kenyans is that they wait until they fall sick, and that's when they hit that they need to be able to have money to cater for or to help them. So sometimes this happens when they don't have money, so they end up borrowing. Sometimes this happens probably when they're in a very tight spot, so they may decide to even take loans to get to seek medication. Unfortunately, some of them who don't succeed may end up not even getting any kind of health service at that particular critical moment. So what we are doing right now, we are creating a drift, or maybe a paradigm shifter in the mind or the thinking or the planning around healthcare. Don't wait until you're sick. Start now. Just pay 276 shillings. Continue paying for you, your wife or husband, and your children.
So this 276 is per day, per week, per month?
It's a daily payment. Yeah, and basically what we are saying is that we are trying to understand how the earning habits and also the spending habits of the ordinary Kenyan. And we are saying that no other healthcare plan is available to really stand and walk the journey of health with these people. So we are saying just put aside 276 shillings. And the moment you subscribe or you become part of our family as Checkups, once you start paying, you automatically are able to access the services. We're not saying you have to wait until you complete paying for the 100 days. Immediately you become a member, you start paying, and we see demonstration of discipline in terms of payment. You and your family are covered. When you fall sick, you may not necessarily need to call for Harambe. You may not necessarily need to take a loan. All you have to do is just call our center, and then you'll be able to access our services. Yeah,
that's great. Last question on that is, when I pay that much money, what range of services am I able to get?
Thank you. So, as I mentioned, we offer outpatient services. So, anything that is covered around outpatient, you're able to really get the services from our side. You have doctor's consultation. When you walk into a facility, if you're a member and you're paying that, you'll not need to pay consultation for the doctor. We have essential laboratory tests. Let's say maybe you have a sore throat, you have a running stomach, you have some infection, some bacterial infection. Those are basic outpatient kind of situations whereby you may need to run some outpatient kind essential laboratory tests, so you will not pay any for that. Then of course diagnostic. Once a test is done, they need to diagnose and say what is the issue. You not have to pay for that because you're already a member. And then of course we have what you have. We have an added service that we offer, which is drug delivery. So once the diagnostic is done, the prescription is generated, and you make payment for whatever medicine you. Then we can ensure that the medicine is delivered to you. Yeah, sure.
Checkups Medical seems to be a company that incorporates several aspects. You mentioned off camera that there is the physical outpatient clinics, there is the digital health, and there is the mobile clinics, like where we are now.
Sure.
Right? Just let's break down each of them. So you've explained, I think, part of the physical clinics, what you do, right?
Sure.
Let's talk about the digital health part. Where are you guys coming from?
Well, I think that is our focus. When we talk about breaking barriers to accessing help, this is actually where it happens. All you have to do when you fall sick, you need to just dial our number. Call 0111 050 290, and you will be connected to a call center. Our call center will transfer you to a doctor within 4 minutes. The doctor will start doing his assessment, and if there is need be, based on the assessment of the doctor, a nurse will be dispatched to wherever you are within Nairobi metropolis, and within 30 minutes you should get a nurse reaching out to you, and the nurse will be able to do basic vitals and assessment, of course in liaison with the doctor, digitally or virtually. And then, of course, if they need to collect a sample from you, they will do that, take it to the laboratory, and then the sample results will be sent to the doctor. The doctor will reach out to you virtually and be able to give you the results, explain the results, and then, of course, prescribe. If you are a member and you subscribe to our plans, medical plans, depending on which one you are subscribing, the medicine will be delivered to you wherever you are. So basically what we are saying, we are changing the whole concept of healthcare, whereby it's when you fall sick, you go to the hospital for outpatient kind of cases. What we are saying is that the hospital services can be brought to you wherever you are.
Okay. All right. Now, assume the case where somebody will need advanced care.
Sure.
So how do you go about that, transferring the patient and advancing care as needed?
Yeah. As I mentioned, after the call center, you're transferred to our doctor. Mm-hmm. Our doctors are very, very well trained and are qualified. They will do the assessment and they will make a judgment, the virtual assessment, based on the protocols, the treatment protocols that are there. And based on the assessment, they will recommend either you may need to be, if it's a critical or an emergency case, you'll be referred for admission. And already they will assist in the admission process by reaching out to the facility that probably inpatient cover is, and preparing the notes, the admission notes, in liaison with the doctor on the ground. So that way, and also we use our network to help coordinate the ambulance services for you. So that way, we're able to really assist that kind of situation where we have an emergency. As I said, you may have a patient who requires inpatient care. The patient will be, based on the assessment of the doctor, the patient will be referred for inpatient admission. They will not be treated or managed from a virtual perspective. Yeah.
And you work with other hospitals where you transfer patients to for inpatient care or within checkups?
So checkups is an outpatient tech-enabled
Outpatient.
facility, but we have extremely good partnership with other hospital institutions and also insurance companies. So we're able to use that network to help you as a patient in a critical state to get the easiest and the fastest way to get to the hospital for admission. Yeah.
All right. That's great. Now, are there particular set of patients that you handle from digital perspective, or it's just across all different ailments?
What we say is that any outpatient condition based on the doctor's assessment is managed digitally. Let's say you have a sore throat, the assessment is done by the doctor, and then in that particular case, a nurse will be dispatched because we need to collect a sample and run a laboratory test to it. So that is one example on how we can manage. You have a running stomach, the same thing can be done. And the beauty about this is that within 4 minutes you're talking to a doctor. In a situation whereby the service is not available and you are, let's say at your home, you'll need to prepare, take maybe a matatu to the nearest hospital. You reach the hospital, maybe it takes you about 1 hour to reach the hospital. Upon reaching there, maybe there are many patients lined up, so you wait for another 2 hours or 1.5 hours before you get to see the doctor. So we are saying that we are reducing that 3-hour period, waiting period, to 4 minutes you're already engaging and talking to a doctor. Yeah.
All right. Now, this might work so well in Nairobi. It's at Metropole and there's connection of roads and from one area to the other of the city and the county. Somebody is in the most remote area. I don't know which most place in Kenya is the most remote, but let's say, for example, somebody is in Mandera,
Sure.
somebody is in Busia, or somewhere in Kwale, wherever you can think about. Can they still be able to use checkouts?
Sure. We said the condition is, are they able to access a phone? Can they be able to call? Those are the conditions. What we are doing as checkups, we have a pool of dispatch nurses. So these are nurses we've partnered with, we work with. So in different parts of the country, an example is like in Kirinyaga County, I think we have some partnership there. So if somebody is sick and is in those regions, they need to call. They'll start talking to a doctor. And the doctor will make assessment. And if the doctor's assessment requires the nurse to quickly visit the patient, so the nurse that is nearest to the patient in our panel, in our pool, will be notified digitally, and the nurse will quickly access the patient and be able to start off the necessary assessment at the nursing level. So it's possible. I would say that we can scale it up, yeah, but it's possible and it's happening.
Thank you so much. We are going to take a break, and when we are back, we will go right on to talk about the mobile clinic. Stay tuned. You are watching Body Garage, the art of well-being. I'm your host, Dr. Cheps, and we are talking about digital health. So, Peter, you had explained a lot about the solution and digital health. The question I have is, when you say digital health, what do you mean? Are we talking about which mode of access are we talking about? Are we talking about an application, a website, or just a mobile phone that I called?
Yeah. We are integrating all aspects of digital technology to deliver health. We are deploying phone call. We are utilizing WhatsApp messaging. We're also deploying an app. It's called a dispatch app for nurses, and also dispatch app for medication for patients. So it's a fully integrated optimization of a digital platform to ensure that there's efficiency, fast and also cost-effective delivery of healthcare. Yeah.
Now, Where would we stand as a country in terms of utilizing digital health services? When you look at the people, yes, mobile phone penetration, smartphone use might be quite promising, but when it comes to actual use of accessing health services through mobile platforms, where are we?
I can say that we are making a lot of progress, expanding significantly in that aspect, and I think it's a direction we cannot maybe change the course. Think about it. If you are some county, let's say Turkana County, and you need to access a cardiologist, there are no cardiologists, maybe one or two, or maybe none in Turkana County. But with digital technology, you can be able to virtually be able to consult a cardiologist who's seated here in Nairobi. So that is the kind of solution we are talking about. No one should be denied access to healthcare because we have the digital platform which can be able to offer that, and that's what Checkup stands for. Yeah. I would say it's the trend in the world. We can look at a good example. It's a few years ago. Everyone had to wait until end month they get paid. They go to the bank, withdraw money, and then travel maybe overnight to up country to pay a friend who was building a house for them. But right now, you can be able to transact all that through your phone, through mobile money on your phone. You can build a flat or a house many kilometers away from you without touching money. That is the change that's happening in the world. And this is also happening in the healthcare sphere. And we are the drivers of that. We are pioneers and we want to make it a reality.
And what will you say from your experiences as a company, not from the general industry, from your experiences as a company, how many years have you been in operation?
I would say that we've been in operation since 2017.
2017.
Yeah.
So how is the progress? How is the uptake and the response and feedback?
Quite good. I think we are growing the subscription, the people who are signing up to our services significantly, a double-digit growth year on. And the good thing is that it's being, I think I would say the COVID period really boosted the digital adaptation in Kenya. So it's not really a strange concept when you introduce or talk to. But I would say there's still a lot to be done in terms of the healthcare industry to ensure that the capacity of digital to deliver quality and affordable healthcare can be optimized, such that people are not denied, they're not able to get the quality healthcare just because of distance that separates them from specialists or maybe doctors. Yeah.
Let's move on to the other section that your company is offering. You talked about wellness, somehow also intertwined with the mobile clinic. What is that about?
Well, I just want to surprise you that based on the interactions that we've had, majority Kenyans do not even know what wellness is. Majority Kenyans have never had a full health care screening done on them. So this is one aspect of our strategy, is to create awareness about wellness. Wellness is just having a full body screen. Check your kidney function, check your liver function, check check out for maybe hypertension, diabetes, check out for any kind of abnormality that could be there or could be developing in your body, and have an immediate intervention. It's more of a preventive kind of approach. Once you do that, then you're able to have better treatment outcomes. Many people are diabetic, they're walking in the streets, they don't know they're diabetic until they start getting the complications of diabetes. Some even end up losing their feet. Many people are hypertensive, they don't even know they're hypertensive until one day they get a stroke in their bed at night. So we can prevent this by having a wellness done, and in the wellness the screening is done, and once the screening is done, if there's a problem, it's identified and a proper management treatment is initiated. And this actually avoids complications that can come with the disease.
Now, how do you go about that? If let's say I have heard about checkups medical today, so how do I go about to now get the wellness arrangements to be done?
Okay, so for us, we have different packages. If you can subscribe, you need just to call our number or check our app on the website. and you can be able to subscribe for our services. We have 3 plans. We have the classic cover, we have the smart cover, and then the deluxe. The classic is about 5,800 Kenyan shillings per year, and then the smart is 10,200 Kenyan shillings per year, and then the deluxe is 24,000. Now, the classic will allow you to have a full wellness done for you. Besides that, you'll have consultation without pay to our doctors, and then we have laboratory limits for essential drug tests of about 15,000 Kenyan shillings, and then diagnostic of about 10,000, and be able to get 15% discount on medication. So what we are saying is we are putting together a package. We are talking of 5,800 Kenyan shillings for a full year, and you get all those benefits attached. That is for classic. For smart, we are talking about 10,000 because we have an extra 10,000 shillings for medication that you can access. You don't need to buy. That is one way. The other way is we partner with the insurance companies, and we help deliver the wellness checks. Like today, what's happening here at KCA, we are doing a wellness for the staff of KCA, and they automatically become our subscribers for the classic care, so they can also enjoy those benefits that I've talked about.
So when you say the package you paid per year is, I come and test the wellness package once a year?
Yeah, once a year. And then you're able to access our doctors. You can just call, you don't need to pay for the subscription until you reach your limit. I mean, you don't need to pay for consultation. For laboratory, you can also access laboratory tests without paying until you exhaust your limit. And so what you're saying, the package is able to really support you almost full year without necessarily spending extra money on consultation, laboratory tests, diagnostic. Yeah.
Now, what is the need that made you guys to come up with this part?
Yeah, now when you look at our demographics, it's only 4% of the population that can afford insurance. Those are covered, about 3 to 4%. What happens to the other 96%? What happens to them? Yeah, so that is, we are trying to answer that.
Yes.
We are saying, for those who cannot afford, can you plan for your healthcare? Come to checkups. Let's help you plan such that you don't have to take a risk to wait until you fall sick and then you start looking for money for treatment. Start investing right now in planning for your healthcare. Let's do the wellness, so that we tell you if there's a risk in terms of chronic disease, and then we enlist you to the chronic disease management plan, which will help you will walk with you the health journey of managing that disease. Yeah.
Let's talk about now the mobile clinic where we are. We are inside a bus, right? Yeah. So what happens in such a setting?
First, we are in an ultra-modern, say, mobile hospital clinic. We normally call it a hospital on wheels, because it's a fully fledged hospital. We have laboratory services, we have x-ray services, we have doctor consultation services taking place here. So we're able to deploy this to any part of the country. So wherever we need to do a wellness, even if it's in Kirinyaga County, even if it's Bungoma County, wherever it's Mombasa, all we need to do is just move with this bus. It's like a moving hospital. And we're able to deliver that service because not everyone can be able to come to Nairobi or come to a particular facility. Yeah.
And I can see even where we are sitting is an x-ray compartment.
Yeah.
Now that makes me ask the part of a question we started with, the part of quality and quality, effectiveness and related and affordability. When I see something like this, I ask the question of quality and safety. How do you ensure that it's such a moving structure?
First, this is a fully registered facility under the regulator, the Kenya Medical Dentists and
the council.
Yeah. So it's fully fledged, so they've done the inspections and been given all the necessary registration. Second thing, the personnel that handle these are doctors and laboratory technicians and pharmacists. So we have trained people who handle this. So you can have all the confidence that when you come here, you're going to get correct results. You'll get them fast, quick, at an affordable cost. And that is actually the essence of urgent care that we provide at Checkups Medical.
How is the experience so far with this part specifically? The hospital on wheels?
Yeah, it creates a lot of excitement. Wherever we go, we get very positive reviews and a lot of excitement because the facilities that are here are amazing. In some parts of the country we go and probably will not get the same facilities in the local hospitals around. So we give them a chance at least to, even the doctors around there, to have that experience of using this kind of facilities. So it creates a lot of excitement and also a lot of positive reviews on our side. And we are proud as Checkup to be among the leaders, I would say among the leaders in having this kind of hospital on wheels available for wellness and also available for clinical services anywhere in the country.
Are there any challenges that you've experienced in such a model of delivering health services to the people?
I would say that nothing really that we cannot handle, but of course we have issues around acceptability of maybe digital as an option for acceptability, the general predisposition of the people. They have to leave their house and go to the hospital to really get treated.
We are used to hospital. When you're sick, you have to be seen physically.
Yeah, so it takes time sometimes to win over and be able to let people maybe have that experience. And I would say that once somebody has tried our services, they become our advocates because they get extremely good kind of customer care experience and they're able to share the experience with other people.
Thank you so much. It's been a pleasure having you.
Nice.
I think we are now done on the part of discussion. We are going to, in our next part of this show, we're going to take a tour around these mobiles on wheel, and we're getting to know more departments and subsections within here. Thank you so much, Peter, for your time.
Thank you.
All right.
Okay.
Join us on the next part of the show. Okay, we are in the first part of the mobile clinic. You can see there's somebody here. Hi. So what happens here, Peter?
Welcome aboard the hospital on wheels.
Yes.
So this is the first part or compartment. Of course, we have where the driver sits. He's part of the team. He takes us wherever we want to go.
Yeah.
And then this is a consultation space for the doctor. You can see the doctor is seated there. So the doctor will sit there, he has his computer and everything and whatever he requires. And then the patients can come and sit here and he can do all the examination. Yeah.
You can see even the AC and microphones, almost like an actual physical hospital.
Yeah, sure. As I told you, the doctor will not lack anything that they require to do proper examination of the patients. Once they walk inside here, they'll be able to capture all the necessary reports and post them to our system so that we can have review of the reports at any given opportunity. You talked about the AC. We try to make sure that the environment is conducive for proper examination. Some areas we go to, the temperatures are extremely high, so this comes in very handy.
Great.
Yeah.
Wow. Thank you. Now we can move to the second compartment. Join us.
Yeah, welcome.
All right, welcome to the second part of this hospital on wheels. So we can see some item here, the other one. So Peter, which part of the facility?
Yeah, so this is actually the X-ray room. And as you can see, we have the X-ray machine here. And this is where the wherever client can stand so that the X-ray can be taken. And of course, the processing of the X-ray is done there. So it's a very important part of the hospital because most of the cases that we go out there require X-ray examination, especially chest X-ray. If you are dealing with border, there are people who really exposed to a lot of cold and very harsh kind of conditions. So they would require X-ray, and we are able to really do that X-ray and process the results within a very short period of time. So the doctor can be able to properly give a diagnosis within a short period of time.
It will not be easy to convince somebody that you can have X-ray machine inside the bus, considering the technicalities of safety and the power that this machine usually consumes.
Yeah.
Been able to achieve that.
Yeah, of course it's very safe, I can assure you, because these are systems that have been tested. And then of course there is always, whenever the X-ray is being taken, the room is closed, and then there's that privacy and also enclosure to make sure that it's only the client who's subjected to the X-ray. And it's safe, there's no risk around it. And the good thing is the results they can be transmitted and read immediately by the doctor, wherever they are. So you don't need to wait for maybe processing of the film before the doctor can read. This is an automated system.
It's a digital
system. No, you don't need to. So the doctor can be able to interpret the results. Yeah.
That's great.
Okay, thank you.
No more questions. We can move on to the next section of this clinic. We are done with the X-ray section. Now we are into the laboratory section. Yes, sir.
Yeah, so this is where our laboratory is, and I'll introduce you to my colleague. We'll pick it up from here so that he can take you through what happens actually here within the laboratory.
Part 3 of this clinic is the laboratory, and we have Hudson here. Hudson, take us through your department.
Okay, thank you, sir.
Yes.
Okay, my name is Hudson, and this is the lab department for checkups. I'm the lead lab tech here, and basically what we do here is laboratory tests from immunoassays, biochemistry.
Ziko wapi hizo? Where are they?
In your electrolyte machines. This is a biosafety cabinet. For full hemogram, I've mounted some machines because I use them on a need basis, depending on the package I'm going to do for the corporate companies. So I mount my machines here for full hemogram, chemistry, and we have where you can collect urine samples. You have a washroom here.
Kuna choo hapa ndani ya bus?
Yes.
Inside the bus?
Yes.
All right. Now,
okay.
Before you proceed, when the patient comes, where do they go to?
Okay, the process flow is when a client comes, they use the front door. They come in, and I welcome the client here, and then I explain the client the packages we are doing. Yes, I explain the client with the packages we are offering, the tests we are offering. Then I take my blood. This is just to improvise. This is an area we improvise. I do my phlebotomy here.
Assume I'm the patient.
Yes.
I'm seated here.
Okay, you're welcome. So we do chemistry, biochemistry, immunoassays. We do up to special chem. Special chem, they are like prostate antigen tests, cancer markers. It's a level 3 lab. Basically, everything is done here for diagnosis. Yes. So you come, I take your blood, I run your tests, we share on mail. Yes.
In one of these machines?
Yes, all of them I will mount on a need basis. If the package comprises of come with biochemistry machines, I mount them. I've unmounted some because the package, the services I'm offering here doesn't need that machine. So I unmounted them.
So after here,
we have the refrigerators where we store our samples.
What is this, sorry?
This is a microscope.
Okay.
For microscopy and urinalysis and stool diagnosis. This is a biosafety cabinet for highly infectious airborne diseases. With COVID, yeah, we can do our COVID isolation specimens here. And then these are refrigerators. This is my colleague is already at work.
Yes.
Urine machine, analyzers. Then we have refrigerators where we store our samples temporarily. Yes. We store our samples temporarily. Here is where we keep our samples. Like for example, when we have gone outside Nairobi, we've gone maybe to Nakuru or any place outside Nairobi, we store our samples here so that they have good temperatures. Yes. So there are 2. So it's enough for any offer we can accommodate. And then here where we store drugs and equipment.
All right.
Yes.
the storage and everything.
Yes.
I can see you have the AC also in the lab.
Yes, we have the AC. The temperatures are controlled in the lab. There is a required temperature that is supposed to be used, room temperature.
Yeah.
So when we go to a place where there is a lot of sun or it's hot, we normally regulate with this AC. And then when it's extremely cold also, we regulate with the AC at the lab.
Great.
Yes.
All right. Any other thing in your department?
A doctor's observation and physical observation room here.
Which we are going to go to
Yes.
next. Yes.
We have even a bed here. We
Yeah.
can observe you.
Okay.
Yes,
All
physical examination and everything. It's here.
All right.
Yeah.
Well, thank you so much for your time.
All right.
Thank you also. We have come to the end of our discussion today with Checkups Medical, from our discussions to the tour inside the hospital on wheels. As we come to the end of the show, I would like to invite Peter to give us a closing remarks.
Thank you very much. You've had a feel of it.
Yes.
You've seen and you've witnessed.
Exactly.
We are in the business of making healthcare affordable and accessible to all. And we believe strongly through the wellness initiative of taking healthcare to the people.
Yeah.
We are going to get more people access healthcare, and we are going to transform the healthcare industry.
Exactly.
Yeah, thank you.
Thank you so much, Peter, for your time. We really appreciate it, and God bless you.
Thank you too.
Now, if you want somebody to come to your house, to your place of work, and to do assessments for you, blood tests and the related, you know who to go to. Otherwise, we really appreciate that you've watched this show this far. This has been Body Garage, the art of well-being. I've been your host, Dr. Chepsi. We will see you next Thursday.